Hi, I'm Dr. Jill Halberg, Medical Director, Reach Out and Read of Indiana. You're watching this video to help with some simple steps you can take to make your Reach Out and Read program run smoothly. We'll take you on a tour and show you things that will set you up for success. As well, we want to be cautious about protecting ourselves and our patients and use the Project First Line guidelines to protect from infectious disease.
Reach Out and Read is about so much more than just making sure a child goes home with a book, and that begins as soon as a family walks through your door. Providing a literacy-rich waiting room environment promotes reading and emphasizes its importance. The waiting room is also a wonderful opportunity to provide information about community resources, such as programs at the nearest local library and museums, and where to find high-quality early learning centers in the area. With physical objects like books, tables, and handouts present in the waiting room, it is important to keep all surfaces clean. Project First Line teaches us that there are reservoirs in the healthcare environment where germs can live and thrive. Water and wet surfaces, dry surfaces, dirt, dust, and devices. It is important to think about the possible reservoirs in your waiting room and exam rooms, and what you can do to eliminate their threat. Be sure to wipe down bookshelves, tables, and chairs with hard surface cleaning procedures for your clinics. Don't forget to disinfect the children's books. Wipe down covers with rubbing alcohol or white vinegar and let them dry overnight. Hanging posters of books and literacy events in your community is a great way to encourage reading at every turn in your practice. Not only that, but the colorful posters create a more inviting and colorful environment. Framing or laminating posters creates a surface that is easily cleanable without compromising the integrity of the posters. Posters can also be a great opportunity to add QR codes, which allow families to easily make connections to more in-depth resources. Providers prescribe new age, language, and culturally appropriate books and talk to families about the importance of reading and how to share books together to develop the bonds and supportive relationships that set a child on a pathway to success. Organizing your Reach Out and Read bookshelf in a way that makes sense for your workflow is one of the most important steps to setting up your clinic for success. It is important that books are easily accessible in the clinic and that there is an efficient system to ensure that the book consistently gets into the provider's hands prior to the visit. Organizing books by age and book type is also helpful, and some practices even place other resources for families inside each book when it is first placed on the bookshelf. Reach Out and Read Indiana staff are available to consult with you on an individual basis if you have questions on how you can best maximize your workflow using bookshelf organization. Another important element for the Reach Out and Read program is an effective system being used to track book distribution. Some clinics utilize a basic tally sheet that they keep with the book supply, so that a tally is made whenever a provider or nurse takes a book, and then keep those numbers to complete the biannual progress report and future book orders. To prevent the spread of germs, it is important to keep the bookshelf used for Reach Out and Read in a staff-only area. By keeping it in a staff-only area, you can help prevent the spread of germs from having sick children coming into contact with the books. You are now ready to actually enter the exam room and talk to a family about the importance of reading aloud together. We'll demonstrate the substance of the intervention in another video. For now, take a moment and think about your own exam room. If you have to set the book down before giving it to a family, identify a safe space in the exam room where you place the book every time. That will limit exposure to germs and make sure to sanitize that area regularly. The goal is to give children the cleanest book possible. If your practice has a bookshelf of gently used books that is separate from Reach Out and Read books, It is okay to keep those in any space that makes sense in your practice. Many clinics have gently used books in the waiting room or at the checkout counter for patients to take extra books home. Keep that shelf as clean as possible by wiping down bookshelves. Book covers can be cleaned with 70% rubbing alcohol.
I hope this video has shown you some easy ways to make your Reach Out and Read clinic successful and protect yourself and your patients from infectious disease with Project First Line.